Welcome back. We are with our Ask the Doctor segment. And so, okay, we're talking about pelvic pain, and I am experiencing that, but there's a good reason. We were just talking about that. But women experience it for other reasons. Dr. LoRissia Autery is an OBGYN at Walker Women's Specialist with Walker Baptist Medical Center, and she's joining us now to discuss some of what's causing some women to have pelvic pain and some solutions. So thank you for being with us today.
Thank you for having me.
So first of all, what are some of the causes if a woman is having pelvic pain? What tends to be the main cause?
I think a lot of women tend to think that it's always gynecological, but there could be many causes. There could be ovarian cyst. You could have just regular cramping with periods. You can have endometriosis. You can be pregnant. You can have a pregnancy in your tubes. It could be your bladder. It could be your colon. It could be muscles. It can be nerves. So there's a variety of causes of pelvic pain that you definitely need to speak to your physician about.
So would you go to a primary care physician, or would you start with an OBGYN or a urologist if it's a bladder issue?
It never hurts to start with your primary care physician. If you have a history, or if you have a OBGYN that you see on a regular basis and you have a history of fibroids or a history of ovarian cysts, then you definitely can start with an OBGYN. A lot of women will only go to one physician, and that happens to be the OBGYN. So sometimes we take care of a variety of issues. If it's something else that we don't necessarily deal with, then we'll refer to the gastroenterologist or the urologist as necessary.
Is there a way that we can differentiate between pain, you know, okay, I can take some Advil or Tylenol, the pain goes away, but then when they need to seek out their doctors, is there a way to sort of differentiate or know when to reach that point?
There is. So if you are taking over-the-counter medication and it resolves, then you can continue to take that. If it's not resolving, or at your next doctor's appointment, you may want to mention that. Usually if it's a pain that has a source that you know about, then you generally can continue with the medications that you have. But if it's a pain that's unrelieved by Tylenol or Motrin or warm bath, or pain that you've never felt before, and it's an acute and it's severe, then definitely call your physician.
And you just touched on it briefly, but is there anything at home to provide relief, any remedies that we can do?
Warm bath, warm heating pad. For some women, they just using different types of bath and body washes or drinking certain things will cause their bladder to become irritated. So avoiding some of your key triggers will help with some of that. If none of those work, then definitely speak to your physician.
Okay. And if someone is watching this segment and they want to ask you a question specifically, what's a number? How can we reach you?
Our number at the office, please call us. It's 205-384-4801.
All right, Dr. Autery, thank you so much for being with us today. Some good information there. And I've got a question. Stick around. I have a question about the babies. So.